look after
Look,
yourself?
I think if there was one thing, it's nutrition.
Yeah,
For sure.
Yeah.
That's the foundation. Like if people would change that and really make a conscious effort, and me included, like I'm terrible at it sometimes, and I'm really cognizant of it.
Yeah, I just had a burger and told you how tired I am. And I knew it before I ate it.
Curiosity has always driven me to explore the world in new and creative ways. Hey, I'm Jordy, the CEO and co-founder of Mode Healthcare, and alongside my Texan mate, Dr. Matty Moore.
Hey guys, Dr. Matty Moore here.
We're on a mission to uncover new ways for people to live, work, and play. From bustling cities to remote corners of the world, we're on a mission to uncover the secrets of holistic well-being. We'll talk to experts, dive into new wellness trends, and explore the age-old practices that still hold value today. So join us on this journey. Each episode will bring you stories and insights that will inspire you to live a healthier, more balanced life. This is The Modern Way.
I don't even know where to start. This is our second time trying this podcast, so fingers crossed things will go to plan. Thanks for tuning in. This is The Modern Way. This is our first ever episode, and it's a long time coming. We've both been on a lot of podcasts, and I've been kind of over it, to be honest with you. We only ever get to talk about the surface level. Every now and then we get to dive deep, and I don't mean to sound rude or anything like that, because I love chatting to as many people as possible, and I'm sure you do too. But this podcast is unique. I think it's a really nice opportunity for us to expose to the world what we're doing here at Mode. Challenge some thinking, and just look at health and wellness in a different light. And it's really hard to express what we do through a pretty Instagram photo and those sorts of things. So here, this is what we're doing. I'm Jordy. I'm going to probably be one of the constants on this. This is Matty.
Hey there.
We're both the founders of Mode Healthcare, and this is our little intro episode where we're going to share with you where we've come from, where we are right now, but probably most importantly, where we're going. So yeah, dude, thanks for driving up.
Yeah, man, of course. I love doing it.
Grab this one close, I reckon.
Okay, cool. Yeah, so I think it's a great opportunity for us to get to know, for people to get to know us better. You know, what we do behind the scenes, where we're motivated. You know, what we see happening for them as our patient, population. So yeah, I'm excited about this. This is great. It's a long time coming. We've been talking about it for forever.
Big time. So I mean, we started in Mode really started 2017. That's when I kind of say it started, when anyone asked, but officially it wasn't until a little bit longer. Before we jump into that, I'm getting ahead of myself. Guys, we're going to talk about medicine here. We're not going to talk about treatments because it's too crazy. Sometimes we might dip in and out of those sorts of topics, but please, if you're listening to this and something resonates, talk to your doctor about it. Don't listen to two dudes on a podcast like everyone else does and then all of a sudden start taking different supplements.
You're an expert.
Right? If something resonates or you feel a certain way and you think that there's another option for you, we call it the modern way, hence Mode Healthcare. Mode being short for modern. But if something resonates, please talk to your doctor, talk to your primary care physician. If they don't want to listen, seek someone else. I'm not saying you come to Mode, but find somewhere else. I think for so long, our parents have instilled in us, like, that's the doctor knows, never stray from that. But as more information is becoming available, I think it's really important. And I think why we're such a good kind of pair in what we're doing is that we challenge the norm. And I think health is literally the most important thing that everybody has and should be concentrating on. So if you're not getting the results from somebody or you think there's another way, it's really prime time right now for there to be lots of opportunity.
Yeah, I mean, opening up that line of conversation is really important, because it helps destigmatize. It helps patients open up, be able to ask those folks what their opinions are. Not that their opinion is, the end all be all, but it certainly is important that we help patients and other people around the nation open up those conversations with people about what we're doing.
Totally. So let's, I know I just said I'm sick of hearing you talk on podcasts and all, we hear the same story a lot, but it is our first episode. So let's do it differently in dot points.
Yeah, cool.
What's led you to the start of Mode? Maybe I'll share my story too.
Yeah, easy. Well, I've always been, interested in general practice, medicine in general from the get-go. When I was a kid, I had some influential fathers, a GP who guided me and, really reaffirmed my interest in science and helping people. And then, fast forward that to, my college degree, where I went, the pre-medical degree that helped me, really in medical school, which was in the Caribbean, which is a totally different experience after trying to get into, stateside schools and not being successful. It really asked myself, all right, what do I want to do? What do I want to achieve? Do I really need the prestigious, Baylor University Medical School? No, I don't. I have, Ross University, a little country Caribbean medical school, but it got me here, and that's all that matters. So next stop point was really getting interested in the plant medicine space, and then, anticipating that kickoff here in Australia, but also, me working in general practice and many emergency departments across the country. I began to really see that I wasn't so happy doing the same old all the time. I began seeing the same patients all the time and feeling like I wasn't really helping, spinning our wheels. And then you and I started a conversation about how we can be more proactive. And, that's really where we are now, is changing that conversation, getting that on the lips of people across the country. Yes, holistic healthcare, but also being in charge of their own health, which is super important.
Yeah, I think it's something that I've really noticed coming into the healthcare space, and I always say I'm intentionally naive. Like, I'm no dummy. I get it. I understand the model. I've consulted for some big kind of healthcare companies, and I see it. And like, if you own a body, you've been to a doctor or you've been to a hospital. I've been to a hospital more than I've been to a doctor, I think, because it's always, for me, I don't want to go to a GP clinic, take a ticket, sit down with snotty kids, and like I fucking hated it. And so I would wait until things go too bad, like really bad, and I'd end up, I remember when I was really young, it was pneumonia and my lungs stuck together, and mum like dragged me to hospital, but I was just so stubborn. I was like, put on a brave face, or it would be a broken bone or that sort of thing. So that proactiveness is something that I think really resonates across all of our patients. And I think on a grander scale, like we'll get into the nitty gritty of what we did and are doing, I must say, like we're nowhere near finished. I feel like we've just scratched the surface.
Just starting.
But man, it's cool. Yesterday I had a friend, super fit and healthy. She called and she's interested in getting ahead of the curve. There's a few little things that are kind of niggling. But hearing somebody call up and go, I'm interested in finding out more information. In this case, it was looking into genetic testing to really see what the blueprint is. That there for me is the marker of, our message is getting through. Don't start thinking about getting healthy when you're sick. Like, how do you start when you're well?
Maintain.
And I mean, there's heaps of books, like I'm looking at Outlive here, Dr. Peter Attia. There's heaps of them around that theoretically talk about what it looks like, but then seeing it day to day and somebody walking in to any of our clinics or online seeing our doctors, and you read some of the notes and you hear from our team, like, how's so-and-so going? Great. They just wanted to catch up and tell us how good they're going. And it's classic when we have new doctors that start at Mode. After day one, like I remember Dr. Rain, after day one, he was like, man, this is insane.
Bouncing off the walls.
I've never wrote notes like this. Like, I'm great. I want to keep doing what I'm doing. Amazing. So I think that's really a testament to where we want to go. Let's talk about, Mode is, what is it? It's 2024 right now, if someone's watching this in the future. We first started thinking about doing something together properly, I would say 2017, 2016. Yeah. There was a brief time, I remember we were going to try and make like that GP in your pocket app. Yeah, an app. Just what the world needs. Another one, like another a podcast, another one. Yeah. So we messed around trying to figure out how we could put doctors in people's pockets. Turns out lots of people are trying to do that and doing it way better than us. We abandoned that idea pretty quickly. I think 2017, you'd recently added a new treatment to your tool belt, which was huge, which was really huge. And I remember you called me one day. I was living in Melbourne. You were Bunbury, I think, at the time. And you
Probably driving down to Dunsborough at the time.
right.
Was still in Bunbury. Yeah.
And we were chatting on the phone. You were talking about like, hey, I don't know where this is going to go, but I think it's something, and it doesn't fit in the current model. And I think that was the thing that I heard the most and went, interesting. Like, there's other pathways, and when we think about allied health, we think about like full-on hippie crazy retreats that, you know, you go out, do that thing, howl at the moon. Like, that's all outlier, and it works for some people. But the mass population and general kind of patient that goes, I feel shit, I want to feel good, I don't know how to get there. When you said to me, like, this thing might be interesting and I'm seeing results, there's something there. I think that's the kindling essentially for this fighter starter gang. That was a pretty interesting phone call. I remember kind of getting off that and talking to Madison going, Matty's just like kind of seeing some epic results, and I haven't heard him speak like this before. I think, what did we wait until about 750 patients you were seeing, I think was the tally, and you were treating them differently than the normal walk-in, walk-out. And then we kind of figured out that the model just didn't fit in a traditional way of working. And so, voila, Mode was born.
Yeah, look, thinking outside the box, which both of us are pretty good at doing. And it was about all I was doing. And so, you know, trying to meld those two types of treatments and medicine generally together was okay for a while, but the answer was really doing it on our own and creating something of value along that treatment line, and which brought us to here. And you know, we're able to introduce other treatments too, and be a really full scope holistic clinic.
Yeah, totally. And I think just to be less cryptic for everybody, what we're talking about is traditionally you feel unwell, you find yourself at some type of GP clinic, whether it after hour walk-in, you go, hey doc, I feel shit, and the doc needs to get you in and out as quick as possible. That's a whole different conversation about Medicare and payments and the business of medicine. So that's kind of separate, but it forces certain decisions. And at least that's my opinion on it. When there's a certain flow of patients and the answer's there, and the answer's been, here's a prescription for this product, or you know, here's the same thing over and over, it creates the same results. And what I've been hearing for so long is we see the same thing over and over and over, and we help it for a little bit, but we're not actually solving the problem.
No, we're not making a huge difference.
And it just sucks. And obviously I remember chatting to you and some of our other doctor friends, and like, there's one thing to be burnt out, like as a practitioner, as a doctor, because you're working so much and seeing great, amazing results. And I think of like a surgeon or someone who's like doing crazy surgery and you're knackered because you just did a 24-hour. Yeah. There's a different type of burnout when it's, I did the same thing and I was pumped all from the second I got to clinic to the second that I left, and I don't think I made a difference. And that was the biggest thing that I was kind of seeing in yourself. I was seeing in other doctors that are kind of in our circles. And that sucks. Like, you imagine, well, you don't have to imagine. You go somewhere, you do hard work, and you kind of are left feeling like, they'll solve the problem for a second. And I guess this is where that root cause starts popping up. Like, what is the root of this? Is it habit? Is it lifestyle? Is it a deficiency in some sort of chemical? But let's not Band-Aid this stuff. Let's look at it. There might be a short-term Band-Aid that's needed, but we actually need to get back to the cause. And I just don't think that general practice, in the way that we know it and we've all just become accustomed to, like, and taken it as like, that's what it is. You're sick, you go there, someone looks at you for 2 seconds, looks at a computer, probably Google something, sends you on your way. That's not okay.
Well, the whole system is based on reaction, right?
Yeah.
Like, that's what Westernized medicine is these days, is, you know, problem, solve it, and then the next problem, I'll see you then.
Yeah.
You know, it's not changing the thought, changing the lifestyle.
Yeah.
You know, making changes in order to fend off that doctor visit potentially in the future. That's not what this system is based on.
Yeah, big time, man. You made me think. The other day, someone said, I was talking to somebody about mode, where it's going, how we're different, and it really occurred to me that if we do our job right, we go broke. And I can't fucking wait. And it sounds funny, but if we help people understand their bodies, their habits, their way of living, and how that's impacting them long term, the better we do that,
The less
they see us. So that's why mode, like, we do a few things differently. And so I'm the first to say we're not for everybody. Like, we're definitely not. Cost, big thing. And so, like, on that point, like, our pricing is a little bit more expensive than other places, but for good reason. And when I say a little bit, it is a little bit. Like, you can't compare mode with walk in, take the ticket like a deli, see someone for 5 minutes, get bulk billed. It's a very different experience because we want to make sure that people have time with a care manager. Care manager is basically like front of house or admin. People might think that's what it is. We call them care managers because, like, our team actually talk to a patient sometimes longer than the doctor does. Like,
most of the time longer. Yeah.
I had a 45-minute phone call with somebody yesterday who's thinking about booking in. Like, that's longer than the initial appointment. And so, like, I'm in the care manager world. So I'm the care manager there. And then they chat to a doctor for the first time, as you know, for half an hour. It's very different to a 5-minute in-out tick and flick. So those things are different. We're not for everybody, but I've definitely noticed that the people that are attracted to mode are kind of invested into their own life and their own well-being. And long term, if we kind of zoom all the way out, I'm noticing our patients seeing us less, and I'm proud of that. Like,
definitely.
It's great.
That's the whole point.
It's the whole point. And so people will get sick. Like, it's not shy away from the conversation of commercials of mode. People get sick and they need to go somewhere, but we want to make sure people get sick less. And, you know, the 4 horsemen that Dr. Attia talks about, those ones we want to push as far away as possible. We're talking about diabetes, we're talking about heart disease, cancers, obviously, those sorts of things. That comes from starting now when you're healthy, not when you're too late.
Totally.
And so that's where I think the model's different. What was the biggest challenge, do you think, from going from that model to jumping on this crazy, magic carpet that we're on, where you've got me running around going, nah, that sucks, do it a different way. We've pulled in staff that kind of intentionally aren't from medicine. What were your biggest challenges and are?
Biggest challenges, I think, is just really myself because of my training and that aspect of, constant evidence-based, guidelines, doing this, that, that philosophy, that curriculum doesn't cover a lot of the things that we do.
Yeah.
It just doesn't. Like gut microbiome, genetics.
Yeah.
Man,
it's insane.
We don't really interpret those things within a 30-minute appointment typically with our patients. That's from our westernized old perspective, that's more woo-woo. We don't deal with that. That's for the, other allied health practitioners and other practitioners. So yeah, getting my head around that really was the greatest challenge, to kind of give my own stiff arm to that belief and really change it in myself. I think that was really because that's been instilled in me for lots of training, lots of years.
Yeah.
So yeah.
Man. I mean, there is parts of the training. I think it's probably would be remiss of us not to acknowledge that medicine and the traditional way of operating has some amazing things, and it needs to stay there. But ignoring the fact that your gut has bacteria isn't the answer. Ignoring that we've got tools that can read DNA and give us the blueprint. Like, that blows my mind, man. Like, we've just implemented genetic testing arm into the business. And I did, and you did, both tests that we offer. There's a million different tests, but we did the 2 main ones. To get that document back of 137 things, it's like if you brought imagine buying, I don't know, what's a good example, a car, and it didn't come with a workshop manual. And you open the hood and you go, well,
what do I do now?
I'm guessing fuel goes in that hole and waste comes out that hole. But between it, I don't know how it's using it. When I got that document, man, I was like, okay, a lot of this I don't understand. And we lean on Amanda and Holly and like the rest of our team who are trained in genetics. But to look at it and go, hey, that makes sense. When I have milk, I feel like this. Like right now, if we just had lunch together, I want to have a little nap because I ate a burger and that bread is killing me right now. And I know it.
Yeah.
But there's no guessing. Like when I ordered, I go, this isn't going to end good. And so at least you know. And those things are so interesting so that when a patient comes in and says, when I do this, I feel that, to ignore the fact that there's genetics, there's gut biome, and then just prescribe something or say you're fine, your vitals are okay, that doesn't mean they don't feel well.
Yeah, it just ignores the cause and effect,
Yeah.
which isn't very smart.
Not at all. No. So, man, I think that's like I'm pretty proud of us of what we're doing. And we're right at the start. So context, anyone who stumbled across this somehow on the internet, we started in 2017 unofficially. When did we open mode first day? It was
October 21.
October 21. Do you remember it?
I do.
So first day, kitchen table. So we'd built a clinic that didn't have the internet or power on yet. Maybe there was some mistake there in Dunsborough. There was something, our internet wasn't connected in time, or that's why it was at my place.
Yep.
And so the first patients that were ever seen by Mode via telehealth were from our kitchen table. Madison and I were downstairs trying to figure out everything. Like, how do you send to Medicare? How do you create a bill? How do you do this? All these things. You were upstairs, so we weren't interfering and quickly like, hey, patient can't get on the video. Just run up the stairs, click here. Click what, man? Man, it was so funny. And I said to someone who was here just before, like, it kind of feels like we're only just getting to the point where, oh yeah, no, I've got the answer to almost every problem. There's still things that pop up, but man, we've come a long way. And then
huge amount of way, like so many different fires you guys have put out and, connected all these different softwares, to make it work, and all those different inflection points which they can crash and, going through all that together.
I'm touching wood.
I know, right?
It's all smooth sailing.
Yeah,
but,
man.
Yeah, dude, you're right. And then so we went from the three of us, one doctor, myself, Madison, who's my wife and practice manager, who comes from the Centrelink Medicare side of the fence, so very amazing at processes and the intricacy in the background, which I'm horrible at. I understand it, but I'm just no good at it. It was a kind of unique team, and I think that's what I'm seeing the most. The more that we play in the industry, the more exposure we have to how different companies run. We're super different. The technology that we use, the way that we treat the patient pathway is closer to a day spa than it is a walk-in practice. It's very different without throwing out all the amazing things from traditional medicine that we need. Like, we need good documentation. We need to investigate. We need imaging. We need pathology. We need all the basics, but then throwing in the things that we are seeing through data and not through opinions. We're seeing data coming through that, hey, let's do some comprehensive blood on this person because the other GP or the other place or this patient's only ever had a full blood count and cholesterol done. Now we've got 28 base metrics. Seeing that come back and then having cross-functional teams, like we'll have, say, Dr. Rain, who's a GP at Mode, and then Amanda, who's a clinical nutritionist. I see on our clinical chat channels, like through our, we use Slack as our comms, debating an outcome. No, I think we should do it. No, I think it should do this. And then to cross-functionally argue about an investigation is the coolest thing I think that we do that no one sees.
Yeah, because then it educates each member on those processes and gets them even better.
Big time.
And therefore building respect. I think one of the biggest things that you and I have learned is greater respect for the patient.
Yeah.
Like, honestly, I have, like, as long as I've been doing what I've been doing, but through these processes of creating what we've created for them, and all the contact, it's really given me a respect for what the patient deals with and how we can make it better for them.
Yeah.
Because I haven't really done that.
Being
involved with someone else's company, with someone else's processes, now we're doing it on our own, and it's just, pretty incredible.
Well, I think that's something that like I didn't have exposure to, is that some doctors that we chat to want to remain completely anonymous. Like you walk in, you see Dr. So-and-so, normally a surname. I think that's the biggest thing. We encourage people to use the doctor's first name, which kind of goes against the grain, but it's a name. It's not like the patient doesn't know the name when they're booking it in anyway. And that's like embedded old school respect, which I like, but it kind of puts a hierarchy there. I really truly believe that if a patient can't feel a connection with the doctor and vice versa, they're going to be less vulnerable. The patient's going to be less vulnerable. The practitioner is going to be less vulnerable and honest and open, because a doctor can only act on the information that's presented. And the more that I see people come through, and this is me being, again, that like naive bystander, I'll have a chat with somebody, they'll go in and then they'll walk out and I'll say, hey, what did Matty say about this thing? Oh, I didn't say. I'm like, get back in here. Hey, said this, because I know that's probably pretty important. But creating that respect between patient-doctor, it goes two ways.
Big time.
And there's boundaries there you still need to put in place. But the more doctors that we chat to and more that approach us to join the team here at Mode, you see really clearly the difference in like that old school mentality, which has its place, I would argue had its place. There's still areas that it's really needed and should be followed, definitely. But for our kind of patient who's rocking up, really going, hey, I don't care what it's going to cost. I just need time with somebody I can just spill all these thoughts to interpret, to then give me process and direction and insight into what's probably happening with my body, my mind, my whatever.
Well, I think it's a factor of technology too. Like, the internet, that's empowered patients to go find information themselves and then bring it up to their doctor like that. That we have to respect that.
Yeah.
There's absolutely no way that we can't.
And dude, if there was no respect there between patient and doctor, a patient will watch something online, take it for gospel, and be too afraid and feel they can't be vulnerable and honest enough with their doctor to say, hey, Matty, I saw that ice baths every morning are the best thing ever for me. Should I do it? And the doctor goes, well, man, you got a heart condition. Man, you've got this. Maybe it is right. Maybe it does do things. But let's look at you individually, because that guy uploading onto Instagram saying you need to do whatever it might be is contextual, and it's important to understand the whole picture. Mm-hmm. But unless that patient feels like they can communicate openly with their practitioner, they're not going to say it. I wouldn't.
Yeah, no way. And gone are the days when the doctor's in his white coat behind his desk looking down at the patient. It's more eye to eye these days because they're empowered. They have the information accessible to them. I mean, as much information as we have, it may not be in their brains like, we have in training and stuff, but, they still have it. It's out there. Yeah. And so we have to respect that.
Yeah, big time. Damn, it makes me laugh. Yesterday, something happened. I'm trying to be like very strategic, as you can tell. I got kind of a briefing from the team, and a patient called, a soon-to-be patient called up and heard of you and go, I want to see Matty. And then as the conversation onboarding with one of our care managers went on, the care manager actually recommended not to see you and to see somebody else because of a few things that were said. Won't get into what they were, very nominal, but it was like our care manager went, oh, they're going to really connect with this other doctor. Let's do that. What it did, which we're learning, was accidentally spiked the patient to go, but hang on, but why not Matty? It's like, well, no, there's nothing wrong with Matty. But you said you like this thing and this other doctor loves this thing. You guys are going to be friends. Like you got to go in there. So eventually, yes, cool, 100% trust in us. We went that way and we said, look, if you don't like him, we'll move you to Matty, no worries. But I think that's the call because we've really flipped the hierarchy on its head. Like I think we try, it's so hard, but society puts doctors, lawyers, politicians, certain things at the top of the hierarchy, and we're trying to just flatten it. And as a team, we go, our most junior team member and our most senior doctor are kind of equals, because without one, the other doesn't happen. And I think that's a really big challenge for anyone who joins our team. The first thing, so lower on the food chain, love it. Higher on the food chain, it's a bit tricky.
Totally, man. It's the culture. Like it's. I'm not used to that, right? And I'm not one to be that way, at least cognitively, right? Yeah. But it's just what, kind of the way you've been treated your whole career, right? But this culture that you and Madison are really trying to make with our team is amazing, because we're all accountable to each other, and therefore nobody's better than we are as a team. But that also trickles down to our patients.
For sure. I mean, that's the thing, like the patient's the most important. Like I remember I was doing a lot of work for Victoria University, and we used to get in arguments because we used to, without getting into the weeds too much, my past role was kind of looking at the business of university, as you know, and looking at how to improve it. What's the future of education was my kind of mission that was given to me. And it was 7 years of my life, which was a long time to look at university as a business and what's happening. And it was the most unique time for me personally, because I've had a range of other businesses, retail, hospitality, design. I've had way too many. But the mission of other businesses, and like let's look at retail, hospitality, is to drag a customer in through some point of difference. Now that remains the same for us at Mode. Like we've got a point of difference. We want people to come in. At the university, we used to sit there and go, why are we debating in this room what we think a 20-year-old that's in the second year of a degree wants, when there's thousands of them walking around us? And we weren't allowed to say, it was we did when they didn't like it, we weren't allowed to say the student's a customer. But in my book, if someone's paying, that makes him a customer. And that's the same in healthcare. It's patient. Oh, we've got a patient. That patient's a customer. They can take their money and go elsewhere. If we don't provide a certain service or value, they're going to leave. And call it a patient, call it a customer, it doesn't matter. I am a customer to every single thing. You're a customer to every single thing you interact with. And we got to look at it that way, because I think the future of healthcare is attracting the right type of patient to the clinic. I'm not saying everyone needs to go to Mode or should go to Mode. They definitely shouldn't, because we aren't for everybody.
No.
But if that sort of patient that's attracted to the way that we think, the way that we look at things comes to us, they need to receive a certain type of value. They need to feel connected to their doctor, get treatment that bloody works. That's probably the most obvious one.
Sure.
And keep them healthy for longer. Like it's pretty simple. Like I said to somebody, they asked me, what's the difference between what you used to do and what you do now? And like, what's with Mode? I'm like, well, it's in the title. It's healthcare. I think the industry for so long has forgotten the care part. Like we all say we're caring for a patient, but we are in a like reactive way. But what does care look like if we looked at it over a lifespan? I think it'd be very different. Like if we really truly cared about patients, and what we're trying to do now is look beyond a prescription, look beyond the thing or the main indication that's brought somebody in front of our doctors today, and look at it at a 40-year period, 50-year period, 100-year period, and go, well, what would we need to do now to care for them then? And so I think that's what the big kind of crazy challenge that we're on, and it's resonating. It's working. I mean, we only have to look at our patient data to see that they come to us less, which in traditional business world goes against the grain. You want them in as much as possible, capitalism sort of style. I can't deal with that. It doesn't make for fulfilling work for doctors. No one wants to go to the doctors. Seriously, like why would you want to go to the doctors? You go when you're unwell, and I think it would be really amazing to see patients come to Mode with some type of
plan themselves.
Yeah, and go, hey, I need help with this because of my mental health, my chronic pain, whatever it might be that's brought them to us. We help them, and it might be a few consecutive appointments to get the train moving and back on the track. But then they spread out. And then I would love to get to the point where we have to hassle somebody to come back in and get their annual blood work. Like I want people on their birthdays. Like this year I did it. I went and did my full blood count on my birthday. I'm going to try to do that every year. It's like the annual service. And we've always said, like, we've got these little things. I'll wake up and it says, oh, geez, your phone's been updated. We don't have the equivalent for our body. You get in the car, lights and things go off, alarms, it's time for a service. But for our bodies, we don't do that. So I think that's an opportunity, and that's where we're going. I think, where do you see the future of, let's start with the future of healthcare and then mode.
Well, like I said, I think the future of healthcare is much more patient-driven. It's empowerment. It's having that base knowledge and coming to that provider and saying, all right, I have this. I'd like to get here. How do we do that? And providing that pathway for them. I think that's the future of medicine. It's not reactive. It's proactive. Yeah. It's getting that mindset, those lifestyle changes, and then, maintaining.
Cool. And then for mode, then what do you think? If you were to go, let's go 5 years time, mode as a company, what are we doing?
Well, I think patients will identify with mode as a brand, really. I mean, they're proud of it. They're proud of what they've done through us. That's what I see in the future. And, providing more services, connecting with more people, obviously, potentially more clinics, more places for them to walk in, more doctors, really changing the message from the inside out.
Yeah, man. And something you just said there is like, I hadn't thought about this, dude, but you just said a little nugget of wisdom, which is patients need to be proud. That's the catalyst, I think, for long-term care is if a patient turns around and goes, I'm proud that I go to mode, or I'm proud that and whatever the clinic is, I don't care if it's mode. If more people are healthier, if I look at it from a societal view, we know hospitals are understaffed and have too many tenants, let's call it, too many patients there. Mm-hmm. We know GP practices are, I guess, struggling is a nice way of putting it. We know Medicare system is just bill after bill after bill after bill. If more people are proud of the outcome they receive from clinics like ours and others that are around the place, that's going to reduce the load on our healthcare system. Therefore, our tax and all these things are implemented. And I know we're just tiny little fish and we're talking so big and whatever, but it starts like this. Like, I think it starts like this, and we're seeing, we've got, pushing 10,000 patients. It's not like we're tiny. And every day, like, I go home and when people say, oh, how's it all going? Like, every single one of those patients matter. And I think that as we grow and as our team grows, it's becoming more and more important for us to go, well, hang on. It's not about the traditional model where you go, we need 1 million patients or we're going to be the biggest. No. I'm happy.
It's that influence.
It's having small that we can look after them well, which inspires a chain of other clinics that do things like us or do it better. Like, it's, we're not the gold standard. Like, we do good. I'm not going to shy away from that. But there's other little takes on things. And if we were to look at it on that grand scheme, that does make a difference. It makes a difference in a bloody big way.
Little ripples, man.
Yeah, big time. Yeah, big time. What's I think, do you have any big impact or things that we could tell potential listeners now? Like, if you were to give general advice to somebody who wants to concentrate on their health, wants to look at things in a different way, what's the one thing that you would do, or maybe you do personally to look after yourself?
I think if there was one thing, it's nutrition. Yeah, for sure. Yeah, that's the foundation. Like, if people would change that and really make a conscious effort, and me included, like I'm terrible at it sometimes, and I'm really cognizant of it.
Yeah, otherwise. I just had a burger and told you how tired I am, and I knew it before I ate it.
Yeah, exactly. So, like, I think that is really important.
Yeah.
What about you? Where do you see the future of mode?
I think that the future for us and for patients is going to be more of a hybrid between what we currently do. I can see that there's having brick and mortar clinics all around the country doesn't solve a problem. The trend is more of our patients feel more comfortable want to see their doctors, practitioners, nutritionists, psychologists from home, from the beach, from work. Like, we live busy lives, so I'm not convinced that physical locations is the direction. I think it's very important. I think I would love to see the future of mode where you've got a mode hub. I'm trying not to say clinic, but it's essentially a clinic on a high street. Like, I'm sick of seeing doctors' surgeries in that medical precinct on the back street and hiding it away. Like,
all of them together.
all together.
The same.
Yeah, all the same. All that kind of thing. But what it does is it goes, if you're sick, go over there. And it's out of sight, out of mind. I believe that we could probably influence the future if we put modes next to the Aesop shop, next to the Lululemon store, next to the cool cafe in town or the local bakery. If we could put mode, and I'm not suggesting that the clinics in these locations are, you go in, you see a doctor, you got a runny nose. I don't think it's like that. I think it's more of a hybrid clinic, which we're already experimenting with this in this location where we are now. So I think that it's a combination of digital tools so that people can talk to a care manager, a health coach, or a doctor at the click of a button for a specialist service that we're known for, or for, shit, I've just woken up with a fever, what do I do? That there is still important. We see very little, if not any of that, because that's not what we are. But I think it's still important to acknowledge. And I think that there's a digital space that's probably an app. I know I just said another app.
Well,
another
taking
podcast.
advantage of technology.
Yeah, like we've got these powerful things in our pockets. We need to use it and harness it. So I think that there's some sort of space there that has access to the mode brand and suite of services. And some of those things will be free. Like, I'm talking, I need to do my breath work. I want to open my mode app and I want to listen to a breathwork teacher and do that, or have a guided meditation, and all those things would be free for our patients.
And you know, some diets, some recipes.
Exactly. Recipes, a cooking show. This podcast lives there. Like, those sorts of things I think would be a value add for our patients, and not a cash grab that I see other places do, which go, download this and all you can do is add to cart all the time. Like, that's just exhausting. I don't think it actually adds any value to the patient's life. I think it adds value to the business that's doing that, because it reduces phone calls and reduces emails and all those sorts of things, which I get. And I'm not saying that that's not important, because ease of access of appointments, bookings, cancellations, reschedules, medication, scripts, all those things need to be managed somewhere. But I think that's the answer. Like, I think that there will be modes in multiple locations that look a bit different, feel a little bit different, but inspire people to go, hey, being healthy is cool. And we both are the first to have a good time. Love a tequila, love a margarita. We both know alcohol's no good.
Totally.
We know it. But I think somewhere in there, how human we are and how human all of our staff, practitioners and patients are, creates this relatability. And if we were able to use our influence to just shift the dial a little bit over time, I think it's longer lives, happier people, better outcomes. Like, it's those things together.
The modern way.
Yeah, it is the modern way.
Yeah, man.
Yeah, man. I was thinking about what my one thing I implemented. I think nutrition. I agree with you. Like, that is the number one thing. And Amanda and Holly, if you're listening, you're gonna love us saying that for sure. But it's definitely
shout out.
That's definitely the one. Dude, magnesium's done a huge thing for me.
Cool.
Yeah, like, I added magnesium in on recommendation from Dr. Rain. Helps me sleep, helps me recover. Magnesium glycinate, I learnt, because the other ones make you go to the toilet. This one makes me relax and not get cramps and a few things like that. That's been huge. I wouldn't say it's the one thing, but it's the one thing over my health stack, I call it. Like, I take a few different things
that you weren't aware of.
That I wasn't aware of. And that's been a pretty big one. Like, I've got prescription medication, but then majority, like the prescription medication that you treat me for, I use in an acute flare up. Like, I'm super stressed, I've got a tool for that. But my general health stack over the last, how long has it been? Well, since 2017 really, has gone away from prescription to nutrition and and supplementation based on what my DNA says. Like, it's pretty interesting when you look at it that way. And remember some of those patients walking in with their shoe boxes of drugs? Like, I hope they're listening, because it's stuck in my brain so much. Being in the Dunsborough clinic, and there was a patient that walked in and it just looked like death with 30 different pills in a shoebox saying, I take this when the rooster crows and this one when this happens. And it was just so crazy.
What a crazy way to live, right?
Yeah. And they come back and the shoebox gone and they've figured it out. And I think that's becoming more and more common. And I think the conversations that we're having with patients and that our practitioners are having are pushing in that direction. And I think it's great.
Totally, man. Those results are extremely motivating. It's what, makes us thrive every day as practitioners, is those, even just one story a day like that.
Yeah.
And we're getting multiple stories of that all week long, and they're increasing exponentially. And that's really, really awesome.
Do you know the thing that fucking sucks is every morning I have to spend probably 30 minutes deleting comments. Did you know that?
I didn't.
I wake up and overnight we have comments from patients and friends of patients leaving, hey, just want to say thanks so much to Dr. Matty. I came with this. I take that. I feel amazing. I send him a message. Hey, thanks so much for this. You'll notice I've deleted your comment. It's a testimonial without a clinical study. We can't have it up there. And so that there sucks so much, but we don't want to mislead because everyone's different. So if you're listening to this and you want to leave us something nice, can you just not say the medicine? Say Matt's a good bloke, but don't, because I'm sick of deleting comments, man. So every morning, like, I wake up and I have all these notifications. I'm like, okay, let's have a scroll. That one can stay. That one can stay. Oh, this one's got to go. Shit. So many times I'm like, man, do you reckon this is okay? Like, it's just not worth it.
It's a tricky space we're in. Isn't it?
Yeah, people don't realize that. So the TGA, the Therapeutic Goods Administration, they manage the advertising of drugs and services, and it's super strict, and it should be. And sometimes we get lost along the way on what can and can't happen, and like, you learn the hard way. Like, we've learned the hard way, and it's there for a reason. But some of it is like, oh man, that's so
just tricky to navigate.
It's just tricky to navigate.
Yeah, because you, most of the time it's well-meaning.
Fully. Yeah.
But it just can't be said.
Definitely. Anything you want to leave with the gang? Leave the people listening with?
No, man. Like, I think we've hit a little bit of an intro. It's a good starter. I think watch this space. Like, you and I are extremely motivated to continue doing what we're doing, continue, connecting with people, getting the message out there, helping people feel better. That's really, it's been amazing to see it actually come in, into view and attainable.
Yeah, man, big time. So if you're listening to this or watching this on socials, whatever, make sure you give us a little follow and a like and a subscribe and all that sort of stuff, as you know. But what would be better is send this episode to a friend. If you think somebody out there needs a bit of a helping hand in any direction, we do lots of things. This by no means is an ad. I definitely want people to look at their health and their well-being and see that there's another way of tackling it. Find a practitioner that you relate with and go after it. Have a conversation. Don't be scared of challenging the norm, asking questions, and if it doesn't seem right, get another opinion. Like, that's what I want to leave people with. If you've got questions, send us a DM and email through our website, modehealthcare.com.au. And if you've got any thoughts, ideas on how we can make this better, maybe guests or stories, I'm all ears. So hit me up.
Be well, guys.
Thank you. No cameras turned off. Yodi.